Hey Marines, I'm Andrea. This is part 2 of the repetitive stress injury series, I guess. Okay, so in the previous video I talked about tendonitis and what to do about tendonitis. You ice it basically to reduce the inflammation. If your tendonitis goes beyond about a 6-week mark, chances are you don't have tendonitis. What it's probably advanced to, or what it was in the first place, is something called tendonosis. And so with tendonitis, you have tendon pieces that sort of fray, but they repair themselves if you add ice and reduce the inflammation and allow blood flow to get to the area to heal it. That's in the other video. It'll heal itself. But what happens is sometimes you have like really a true tear on something. Now, you have a muscle belly, it turns into a tendon, and then that tendon attaches to the bone, okay? So with a tendinosis, what's likely happened is these strands of tendon, some of them have detached, but it's not just a little fray that will reattach. It's going to stay detached. Now, sometimes this is fine, and you can just live like this and have these doing its thing. It might hurt a little bit, you might feel a little bit weakened, but you don't need surgery. Sometimes you need surgery to reattach these suckers. But in that in-between stage where it's not tendonitis and you don't need surgery, what do you do about this situation? Because it hurts and you're weak. You're weak feeling in that joint. So what happens is, perhaps you have this tear here. What happens is there's still stuff that's remaining attached to the bone. What we have to do is increase strength in this tendon. The way we do this is we work the negative on the muscle. So most of the time gravity is enough of a negative. And I tell people just work with gravity. We see what joint it's in. Let's say you need to strengthen your bicep tendon that's right here. It crosses over the elbow. What I usually say is, rest your elbow on like a desk or something. Now, what the action of the bicep, what that is a contraction like this. What we want to do is work the negative resisted. So we're going to use gravity as a resistance, and you work the negative just very, very slowly, like a full 10 to 15 seconds to lower your arm. Sometimes I'll suggest to put like a 2.5 pound or a 5 pound weight in your hand so that you feel like you're resisting something. But what we don't want to do is go past a neutral point, because once we get all the way here and then re-engage, we don't want to injure the tissue. Depending on how bad it is, you'll kind of know your neutral point. Usually it's at like a full neutral, or like a 90 degree in the case of your shoulder. So anyway, you're going to come up like this. With the bicep, I would go all the way down and then just very carefully come back up. Now you're going all the way down, very resisted. You should feel like you're trying not to put it down so fast against gravity. And so you might feel kind of like stops along the way, and that's fine. But what this is doing is working the tendon strength and increasing that tendon strength for, whatever fibers are still attached. I've had great success with this in, we did do a bicep for one person. I've done it in both of my wrists here. Like I got a super bad tendinosis in both of my wrists after babies, because I was lifting him up like this, right? Like off the couch. Well, I keep doing this. I keep re-injuring it. Now it's beyond a certain point. Ice isn't working. So what I had to do is hold a weight like this and just very, very slowly anchor it down. I mean, it doesn't feel like you're doing anything, but trust me, it will help to decrease the pain that's happening, and you'll feel a lot better. You'll get a little bit more strength in there. So hopefully that helps. Your doctor might suggest a cortisone shot if you go in and you have tendonitis, but if it's beyond that 6 weeks, chances are it's tendinosis, and cortisone doesn't do shit for tendinosis. In fact, cortisone weakens the tissues long term. So do your research, and good luck. Hope that helps.